We have said the word triple-demic a lot lately, and it's because RSV and COVID are hitting hard. It looks like the Bay Area is actually seeing the most intense uptick in COVID cases in the entire state. Andrea Nakano has more from the North Bay on what's going on in health. Andrea?
Yeah, here at Tamalpais Pediatrics, it's an understatement to say that doctors have been busy. Waves of patients have been coming in with a number of viral illnesses. This is the first time the Buck family has ventured outside of the house since the flu swept through their household.
I came in with the runny nose, and then all of a sudden, the next morning, she was throwing up and had diarrhea really bad. And then it was like a rolling effect with all of them.
Influenza is what doctors at Tamalpais Pediatrics are seeing the most so far this season.
We typically, between the two offices that we have in Marin, see 100 to 120 patients a day on a busy day. A few weeks ago on one Monday, we saw 180 patients, and that was repeated for multiple days that week.
Pediatrician Dr. Nelson Branco says while cases of RSV are starting to decrease, he is now seeing COVID starting to make a comeback.
One of the interesting ways that we've learned to keep track of viruses in our community is through wastewater monitoring. And so testing in the wastewater is showing that COVID is up. I think the number is 15 or 20% from this week to last week.
Dr. Branco says there is now enough protection in the community with vaccines that masking should be a personal decision, not only to protect yourself from COVID, but from all of the other illnesses going around.
Feeling better, buddy?
Yeah.
For Cherith Buck, she's not only trying to avoid getting sick again, but she wants to do her part to stop spreading the germs.
Trying to protect others because I don't want them to have what we've gotten. I don't wish it on my worst enemy. It's been literally hell.
As families gather this holiday season, doctors say avoid those gatherings if you're sick. And even if you're not showing any symptoms, it might be a good idea to test, especially if those gatherings include the elderly and those that are immunocompromised. In Novato, Andrea Nakano, KPIX 5.